And welcome to everybody here. It really is a privilege for me tonight to be part of a gathering that celebrates not only scientific excellence, but research that genuinely shapes the future of health in this country. So I think the DPHRU really, their work reminds us that health doesn't begin in adulthood, and the importance of studying health right from infancy all the way through to adulthood. And I think the Birth to 20 cohort is probably one of the most well-known longitudinal cohorts in Africa. And I think that really is such a legacy that the DPHRU is leaving. But not that they are leaving. The fantastic news is that they are going to be continuing. And I think tonight is really a celebration of the excellence over the past 15 years, but also an outlook of how this is going to shape the future of where the DPH are going.
As we share today, music, food, conversation, networking, we are celebrating something deeper. We're celebrating 15 years of a shared commitment to evidence that matters, partnerships that endure, and leadership that looks beyond the short term. To Professor Norris, Professor Mickelfield, the researchers, the students, the staff of DPHRU, to our partners at WITS, a very deep and warm thank you from the SAMRC. Thank you for reminding us that health is built over a lifetime, that science requires patience, and that when we, as SAMRC, invest wisely in understanding pathways and supporting research units, we invest in a healthy future for all. For us, it's been a real honor to have been part of the story for the 15 years. We look forward to continuing the story into the next phase of this unit. We look forward to continued strength, relevance, and impact in the years to come.
My name is Karabong Khashe, and I started at DPHRU in 2013. So I've been at the unit for 13 years. I joined the unit to be part of the Soweto first 1,000 day study, and I started as a field worker, and proudly today I'm a senior project coordinator. So really, DPHRU has been a training ground for most of us. And with growth, as my colleagues have said, comes a lot of challenges. But ours is a story of endurance. We were a rapidly growing unit within the highly competitive grant funding space, often having to deliver with limited resources. This meant doing more with less, stretching teams, and carrying heavy expectations with one thing in all our minds: the work we are doing will one day positively impact communities.
When I first joined, we were talking to young women about what did they need in the environments in which they lived to change their health. And the overwhelming message that came back from the young woman was health is important, but actually we need education and we need employment. So we developed an idea to test if we recruited young people from the community that were not in employment, education or training, to train them as community health workers. I'm smiling because many are here in the audience. To train them as community health workers in their own communities, delivering services to their communities. Does it change their health and their futures? We've now trained 220 young people. Those 220 young people have seen over 125,000 community members in Soweto providing health services, many in the homes in which they live. We've conducted tons of health promotion campaigns. I want to say 30, 40, maybe 50 on men's health, cancer screening, substance abuse, mental health, all topics that the community asked us to do. We've delivered app-based health training with NGO partners to over 30,000 other young people across the country. We've supported 2 masters, 1 MPH student, 4 PhDs, and 1 postdoc at that centre. Completed 6 research studies, published 10 papers just from this Jabalani site, and written a book chapter. We've grown 1 non-profit corporation and started several startups. Importantly, we've raised over 20 million rand in direct funding for this programme to keep it running, including now money from the Health and Welfare CETA to train the young people.
One thing I would like to tell you is that DPHRU provided me an opportunity to continue study, to further my studies. So I got to do my master's, graduated while I was still getting paid a salary at DPHRU. You know how stressful it is to be a student and not have a salary, because other things of life have to continue. But DPHRU ensured that I had a bed to sleep on, I had food, I even got to drive my first car. And I can tell you that was amazing for me. And, I got my master's, and speaking on behalf of the postgraduate students as well as postdocs, I can tell you that DPHRU has had immense impact in our lives. And for that, I would like to appreciate DPHRU and Prof. Shane Norris. Thank you very much.
When DPHRU started in 2010, it started with a massive leg up. Not only the infrastructure, laboratories, skills that we inherited from Mineral Metabolism Research Unit, that was an MRC unit for 25 years. We also inherited 2 really important population studies, Birth to 20 and the Bone Health Cohort. And the Birth to 20 cohort was part of an international consortium of cohorts of 5 low-middle income birth cohort studies. So there was a massive infrastructure, both from a science point of view and resources, which meant that we didn't just have to start from scratch, we could accelerate quite quickly. And within that very short period of time, we could go from our core projects multiplied into other cohort studies, filling gaps that Birth to 20 and Bone Health could not address, forming other collaborations, Steve and Kathy with Agincourt, and a whole body of work that now spans easily 12 years. And other networks with Michelle Ramsey and other new cohort studies in the older adults began forming. That immediately multiplied even more, and this is just a fraction of the multitudes of other cohorts. Lisa Ware and the Wellcome funding to start GenHeart, other networks, and now Birth to 20 is Birth to 40, and we actually infield with the cohorts at the moment now aged 36 years. And amazingly, this cohort's got 4 generations. The kids that were born in 1990 are now grandparents. So it's remarkable how things move.
When Shane first spoke about this event, it was about closing the unit, right? So it's really wonderful to be here because we're talking about the continuation of the unit. So really, it's a wonderful occasion. I mean, it would have been wonderful anyway, but it's made extra special by the fact that we are seeing this investment continue and new leadership and new direction. So definitely the start of a new phase.